Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Clinical features of endometrial hyperplasia. In clinical features, the patient presents with excessive bleeding due to the shedding of endometrium. In reproductive age group or in perimenopausal age group women, the first important thing is to rule out the pregnancy. The next is investigation of choice is transvaginal ultrasonography. In reproductive age group women, transvaginal ultrasonography helps to rule out the polyp and the fibroid. It helps to measure the endometrial thickness. If the thickness is more than 12 millimeters, then endometrial biopsy is done.
If the endometrial thickness is more than 12 millimeters, then endometrial biopsy is done.
thank you and thank you for watching.